Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Sangeetha Balakrishnan. Dr. Balakrishnan is an internal medicine physician and cardiologist. She received her medical degree from the Medical College of Wisconsin and is board certified by the American Board of Internal Medicine.
Hello everyone, how are we all doing today? I'm just going to talk a little bit about what you need to know to have a healthy heart. So a little bit of facts to begin with. Heart disease is the leading cause of death in Americans. It's more prevalent than cancer, chronic respiratory diseases, strokes. So it accounts for about 23-25% of death compared to all other causes of death. So it is a big deal. It's the number one thing that's killing us disease-wise. So some other facts. 1 in every 3 deaths in the United States is caused by heart disease or stroke. Lowering your blood pressure accounts for decreasing 50% of your risk for a stroke or heart disease. About every 25 seconds, an American will have a coronary event, which is something equivalent to a heart attack. Every 39 seconds, someone dies from a heart attack or stroke. After having a first stroke, 785,000 will have had their first stroke each year or a heart attack. And then, 500,000 will go on to have another heart attack after their first one. So we're not doing enough after the first one to prevent the second one. And a lot of that is knowledge. About 60% of adults don't know their blood pressure or cholesterol numbers. And only about half, less than half, measure their blood pressure outside of their physician's office. 56% of adults have been told by a healthcare professional to improve their health. So what constitutes heart disease or atherosclerosis or cardiovascular disease? It is basically plaquing of the heart arteries or any arteries that feed any of the organs in the body. This is a pictorial of the plaque buildup in one of the arteries. And then when you have a clot formation, clot is platelets coming together and blocking blood flow, that can cause, a heart attack. So if it happens in the heart, it's a heart attack. If it happens in the brain or the neck vessels, arteries leading to the brain, it can cause a stroke. If it happens in the kidneys, it can cause kidney disease or kidney failure. If it happens in the legs, it's what we call peripheral vascular disease. Patients complain of calf pain or unable to run or have those type of symptoms. So atherosclerosis or cardiovascular disease affects all organs, all arteries, so it is quite prevalent throughout. So just specifically, since we're talking about heart health, these are the blood vessels that supply our heart muscle. And so when you have plaque buildup and then a clot that forms, it limits blood flow. So that causes decreased blood flow and damage to your heart muscle. So that's essentially what a heart attack is, or the risk of a heart attack. What are some of the signs of a heart attack? Pain in the jaw, neck, arms, shoulders, a chest pressure. Sometimes people say, I never had pain. It was just a pressure type symptom or tightness in my chest. Those are all equivalent in the same category. Nausea, sweating, feeling faint, or shortness of breath. I'm sure you guys have heard women and men have different symptoms. But I want you to realize that chest pain and chest pressure is still the most common symptom for both men and women. But women can also have other symptoms such as neck and jaw pain or back pain, nausea or fatigue, anxiety, sleep disturbances. Sometimes women chalk it up to GERD or reflux disease. You know, they think, oh, it's just my reflex acting up, but in fact it's, you know, chest pain or chest pressure equivalent. So that's important to get it checked out. So if you do have these symptoms, what is the typical workup? If you were in the emergency room or you come and see, you know, your physician, you'd get a full medical history, you'd get an EKG to see if you've already had a heart attack or there are signs of you having one. You'd get blood testing to see if there's heart markers that are elevated that prove or suggest that you've had a heart attack. X-rays, an echocardiogram, which is an ultrasound of your heart that checks, you know, how well your heart muscles pump. If one looks weak, maybe that's a suggestion that you've had a heart attack. Stress testing, so putting you on a treadmill if you can't exercise, doing what we call a pharmacological testing, where we give you medications to stress the heart, so doing one of those stress type tests to see if you might not have already had a heart attack, you might not have had that blockage with that clot, you know, so, but you might have had you might have plaquing, so you have narrowed heart arteries, and the stress tests will pick up on that. So say your stress test or any of these above testing is abnormal in some way, then we might ask you to get a coronary angiogram or a cardiac catheterization. Basically, what that does is, this is your plaque buildup in your heart artery. Through the angiogram, we put a balloon up, inflate the balloon, and try to push the plaque against the wall, and then deliver a stent that expands and keeps that artery open. So it went from a narrowed heart artery here to an expanded artery. So the blood flow to your heart muscle is improved. But the point is to not get you there. We don't want you, you know, to need a stent or need a cardiac cath, or to prevent a second one. So what can we do to do that? My absolute biggest recommendation is know your numbers, educate yourself about your body, about what you can do to change how to be healthy. So education, education, education. So some of the numbers that you need to know about yourself, about your body: blood pressure, cholesterol, blood sugar, and your weight. So blood pressure, I'm sure you guys know that it is made up of two numbers, the systolic and the diastolic. The systolic is the top number. It basically represents the pressure that the arteries see when the heart pumps blood. The diastolic, which is the bottom number, is the pressure when the heart is relaxed. So the American Heart Association recommends blood pressure should be measured at least every 2 years, starting at the age of 20, if it falls in the normal range, or more frequent if it's abnormal. So what is considered normal and abnormal? Here is a little table showing you that ideally we want most of us to be in the 120 to 80 range, less than 120 over 80. You're considered pre-hypertensive if you're in the 120 to 139, that systolic number, and 80 to 89, the diastolic number. And then you're diagnosed high blood pressure if you're 140 to 159 systolic, or 90 to 99. You go higher in stages depending on how high your blood pressure is. So factors that affect blood pressure. Some are just out of control. We can't change our genetics. We can't change our age. Women are more prone to blood pressure after the age of 65 than men. African Americans can be more affected by blood pressure. But stuff that is in our control is our diet, our physical activity, sleep, how much alcohol we drink, and our level of stress. So those factors, we can do something about. So why is blood pressure control important? Long-term effects cause stiff arteries. The higher the blood pressure, the stiffer those arteries. It represents stiffness of your arteries. So it's considered, some people say, a silent killer, if you will. It affects every organ system. You have increased risk of stroke, heart failure, the heart attack, kidney failure. So it's very important that we know our numbers, our systolic and diastolic numbers, bring down those ranges to 120/80, those goals, and decrease these risks. One thing that has been shown to help lower blood pressure is the DASH diet. And it's basically breaks down, how much whole grains, how many veggies you should be having, fruits, how much dairy, nuts, limiting sweets to less than 5 per week instead of per day, and your intake of fats and oils. So that's something to keep in mind when you've been diagnosed with high blood pressure. Yeah, I know there's recent articles or recent news about whether your salt intake really affects your blood pressure. I think the jury is still out with research going back and forth. But, as of now, the American Heart Association does say the effects of high salt intake does affect your blood pressure. And then it's important to know salt comes in many sources, just in our grocery stores, in our restaurants, and it all leads to, these risk factors for stroke, heart failure, osteoporosis, kidney stones. Some of the symptoms of excess sodium is puffiness, bloating, weight gain. So some of the foods that we need to think about that have high sodium sources, we don't really think about breads and rolls having salt, but if you look at the food label, they are added to your breads and salts, cold cuts, pizza, paying attention to how the chicken you buy is prepared if you're not doing it yourself. Cans of soup, which is infamous for having huge sources of salt added. Sandwiches, anything that you yourself are not making and other people or other things are making for you, you should be, reading those labels and trying to be aware of what you're getting into your body. Changing gears to cholesterol. So what is cholesterol? It is a substance made by your liver and your intestines. It's the foundation for cell membranes. Cholesterol isn't bad. It's actually, needed in our body. It forms cell membranes, hormones, bile acids. Diets rich in saturated fats, trans fats, simple carbs, they all contribute to your liver producing more cholesterol. And when we talk about LDL and HDL, those are the proteins in the blood that carry cholesterol from your liver to your organs or your blood. Going a little more into detail, knowing where you fall in your total cholesterol level, what causes high cholesterol, and then how it can be treated. When your physician orders a lipid profile, this is the numbers that they're getting and measuring. Total cholesterol ideally should be less than 200, your triglycerides less than 150, HDL less than 60, LDL, ideally less than 130. To break that down further, your LDL, which is low density lipoprotein, it's considered the bad cholesterol. It is the one that carries cholesterol from your liver to the blood. Cells extract the fat and the cholesterol. Too much in the blood can deposit in the arteries and cause plaque. So that's what's causing that plaque. Too much plaque narrows those blood vessels and limits blood flow. When the plaque breaks off, it can cause the stroke or the heart attack. It can also cause that peripheral vascular disease that I was telling you about, which affects the arteries in the legs or in the extremities. So what are the optimal ranges that we want you to be on? Ideally, less than 100, but we'll take less than 130 optimal. We start having the discussion of dietary changes or educating you on awareness when you have 130 or above. It's considered high when you're above 160 and then very high above 190. high density lipoprotein, which is the good cholesterol. This is the protein that picks up cholesterol from your bloodstream, even from the arterial walls, and delivers it back to the liver. So the more you have of it around, the more it's picking up excess from your bloodstream. So ideally, we want you to be greater than 60, 40 to 60 is okay, and then you're considered low if less than 40 for men and less than 50 for women. Just a little depiction of what bad cholesterol and good cholesterol is doing in the body. The bad cholesterol is depositing and narrowing this blood vessel, so blood flow has to go through this narrow range. And then your good cholesterol kind of picks up these plaques and brings it back to the liver. Triglycerides, that's another part of your total cholesterol panel that we get. It's another type of fat that is used as energy source in the body. It's made from excess calories and is stored as fat, and it's included in your total cholesterol score. Also, it contributes to the atherosclerosis or risk for heart disease and stroke. Sugars, fats in our diet, some of it is spent as calories for energy. The leftover is stored into triglycerides, and then you have some of that body fat that you see from eating excess sugars and fats. We want you to be less than 150. You're considered borderline high of 150 to 199, high above 200, very high above 500. If triglycerides are high, what can we do? Weight loss, exercise, avoid refined carbs such as white flour, limit saturated fats, limit alcohol to 1 to 2 standard drinks a day. And then I'm sure you guys have heard of some of the latest news articles that say the intake of your cholesterol doesn't necessarily impact your actual cholesterol level. And studies have shown that that might actually be true. So eating eggs doesn't necessarily increase your actual blood cholesterol level. Eggs, shrimp, lobster, they're high in actual cholesterol, but eating that isn't necessarily something you have to avoid. So the point is, you can eat an egg a day if you would like. You can have your shrimp or your lobster once in a while. You don't have to necessarily completely avoid it if you're watching your cholesterol. So this message of, the all fat is bad message, which we had a few decades ago, when that message came out, everything in the grocery store was saying low fat this, low fat that, low fat that. What the food companies did was, instead of putting fat to keep it flavorful, they just added sugar. So replacing fats with sugar led to us not eating the good healthy fats. Not all fat is bad. And the increased sugar intake caused diabetes, increase in diabetes. So this message of all fat is bad is a bad message. So there's numerous types of fats. The body makes fats from excess calories. It has multiple functions in the body. It helps absorb vitamins and nutrients. Dietary fats, they come in the helpful version versus the harmful version. The harmful version is linked to cardiovascular disease, obesity, diabetes. So what are the harmful fats? They're the trans fats, mostly come from the oils that go through a process called partial hydrogenation. They're added to foods to make it easier to cook and less likely to spoil. They want to increase shelf life for some of these processed foods. And increasing intake of these partially hydrogenated oils, that's what if you're paying attention to your food labels, that's what, anything partially hydrogenated is considered a trans fat. Increases your LDL and lowers your HDL. Saturated fats, which is found in animal foods such as red meat or full dairy products, it also increases your LDL cholesterol. So what are your helpful fats? Those are the monounsaturated fats. They decrease your LDL, help control blood sugars. Examples are olive oil, avocados, peanuts. Polyunsaturated fats are the omega-3 fatty acids. That's why we say try to increase your fish intake, salmon, one to two times, ideally 2 times a week. Some plant sources, flax seeds are currently it right now to increase your source of good omega-3s and polyunsaturated fats. Walnuts, soybeans. So these have been found to lower the risk of heart disease and stroke. Don't avoid all fat. Limit your total fat intake to 20 to 35% of your total daily calories. Focus on the good fats, the monosaturated, the polyunsaturated fats, omega-3 fatty acids, and try to stay within this fat intake limit. And you don't necessarily have to completely avoid all limited saturated fats, such as the red meats or the dairy products, but limit it to 7 to 10% of your total daily calories. But I do encourage you to try to avoid trans fats as much as possible. So just a diagram encouraging what are the good fats, the monosaturated and the polyunsaturated, found in oils, avocados, fatty fish, nuts and seeds. The saturated fats are considered bad, butter. I'm not going to tell you not to use butter, everything in moderation, cheese. And then the stuff that you should try to avoid as much as possible is the hydrogenated oils, mostly found in fried foods, some baked goods. So just quickly on the carbohydrates. So simple sugars versus complex sugars. The simple sugars are digested quickly and increase glucose levels in the blood, such as white sugar, refined sugars. They lack the vitamins, the minerals. Naturally occurring simple sugars are found in our fruits and our milk, which is good. Complex sugars are the refined grains, white flour, white rice versus whole grains. These are digested more slowly and increase the blood glucose a little more slowly. Why do we care about whole grain versus refined grains? The whole grain has all the bran, the endosperm, and the germ, everything. And the bran and the endosperm and the germ is the one that has all the nutrients and the vitamins. So when you have white flour or white rice, all of that nutrients has already been stripped off. And sometimes people say you're just kind of having empty calories. You're not getting the nutrition that the brown rice or whole wheat offers you. So paying attention to what source your carbs are coming from is also important. Added sugar is not so sweet. It's in everything. A typical 12-ounce can of regular soda has 130 calories and 8 teaspoons of sugar. We recommend, for most women, 6 teaspoons a day. So if you have had a 1 can of regular soda, you already went past your sugar limit for the day. It's added in everything, drinks, pies, muffins, ice cream. So once again, read your labels. Sometimes they will change the name. Instead of just saying sugar, they'll say syrup or molasses or cane sugar, fruit juice concentrate, but it's still added sugar. So when you want, something sweet to finish off your meal, consider a fruit. If you want to make your meals more tasty, add spices to them, such as cinnamon or nutmeg. So we don't have to necessarily resort to sugar to make things tasty. I'm not saying completely avoid it, but limit its intake. And then the other important number is your weight. We usually measure body mass index. It gives us an estimate of your overall body fat. As body mass index increases, your risk for heart disease, diabetes, hypertension, and gallstones increases. And also important to know that body fat location is important. The waist circumference, storing our body fat in the gut, is more dangerous than in other places. So waist circumference might be a better indicator of this risk. How is body mass index calculated? It's based on your weight in pounds and your height in inches. Ideally, we want you in the 18 to 24, less than 25 range. You're considered overweight, 25 to 30, and obese above 30. The last number I'm going to talk to you about is your blood sugar. So knowing what your blood sugar is. Food is converted to glucose. Insulin is a hormone that takes the glucose from blood and enters it into the cells, and the cells use the glucose for energy. So diabetes is essentially the buildup of glucose in blood instead of getting it into your cells. So either there's increased resistance or a decreased production of the insulin. What are some of the risk factors? Age, family history, inactive lifestyle, being overweight. Certain ethnic populations are, at increased risk. Check your blood sugar levels at least once in 3 years. If abnormal, at least every year. And when you get that number, when your doctor checks that number, you want to be fasting. We say, check a fasting level, and we want you to be less than 100. You're considered pre-diabetic if you're in that 100 to 125 range, and then officially diabetic, if you're above 126. Nowadays, we're also checking hemoglobin A1C. It's also looking at basically an average of your blood sugars over a 3-month period. So it gives us a better idea of what you have been doing, what your blood sugars have been doing. It is essentially the amount of glucose, the hemoglobin, which is in your red blood cell, is exposed to. So the more it's exposed to, the higher it gets conjugated with. In the hemoglobin A1C, you're normal if you're less than 5.7%. You're pre-diabetic 5.7 to 6.5%, and you're diabetic above 6.5%. And when you fall in that pre-diabetic range, I say that's your wake-up call. That's to say, hey, you need to change your lifestyle, your eating habits, your exercise habits, and bring it down back into the normal. Even if you're a diabetic, losing weight, exercising, getting more active, you can come off your diabetic, some of your diabetic medications. Same with cholesterol. Cholesterol is another story, but blood pressure medications also can come off. And then your alcohol intake. Alcohol isn't actually all bad. It does reduce risk of death from cardiovascular disease. The benefits of alcohol, it might increase your HDL. It has an antioxidant effect. Studies have shown that it has maybe a blood thinning effect as well. But everything I say in moderation, so 1 to 2 drinks per day for men, 1 drink per day for women. And studies have shown that it's not just necessarily red wine. I know red wine got a big boost years back, but the benefit does appear to be for all alcohol. But limit it to 1 drink is 12 ounces of beer or 4 ounces of wine. If you don't drink, don't start, just so you can get the cardiovascular benefit. Because if you drink in excess, it increases your risk of cancer, stroke, diabetes, everything else. So it doesn't make sense to start a habit that you don't have. And then benefits of exercise. This lists 20, I'm sure there's 20 more, 30 more. But it affects our mood, it affects, our blood pressure, our immune system, risk for diabetes, clears out your arteries, strengthens your muscle, multiple benefits of exercise. The American Heart Association recommends for overall heart health at least 30 minutes of moderate intensity aerobic activity, at least 5 days per week, or 25 minutes of vigorous activity 3 days per week. Also add in muscle strengthening activity, like weights for 2 days per week. So when people ask what is vigorous, what is moderate exercise, one way is to target a certain heart rate. And how do you measure target heart rate? You start with 220, you minus your age, which is the maximum heart rate, and then you multiply your maximum heart rate by either 0.65 or 0.8 to find your target heart rate. And 0.8, you're doing an intense workout. 0.6, multiplying it by 0.6, you're having a moderate workout. So trying to target between that range 3 to 4 times a week would be ideal. And if you're on beta blockers, medications that affect your heart rate. You might not be able to target this target heart rate to assess your moderate or intense workout. And the way I educate my patients is to use a level of perceived exertion. There's a scale out there, the Borg scale of perceived exertion, and it basically, to work out where you know you are working hard, you are getting tired, but you can still have complete sentences, but you're getting more shorter breath with the exercise. That means you're probably in that moderate to intense workout. When you can't talk, or when you're having only single word answers, maybe that's more than intense for you. So what you perceive as a good level of exertion is probably right for your body. The sleep is, sometimes very underrated. Your quality of sleep and not just the quantity. Sleep deprivation increases risk of heart disease, blood pressure, stroke. The American Heart Association recommends 6 to 8 hours of sleep. It helps with mood, stress, anxiety, weight loss. Ways to improve sleep: exercise, avoiding too much caffeine close to bedtime, trying bedtime rituals, tea, reading. Me studying in bed usually puts me to sleep. And then, like I said, it's not just quantity in this situation, it's also quality. And I think obstructive sleep apnea tends to be underdiagnosed in our patients, and it contributes to hypertension, it contributes to fatigue. So what is sleep apnea? It is basically when you have blocked airways while you're sleeping. Your tongue, your soft palate, everything kind of collapse onto themselves, and it blocks the airway. So you are waking up multiple times probably without realizing, or you're snoring. Your partner might say you snore a lot, or you kind of wake up gasping for air. Those are some signs, not all, but some signs that maybe you should get that looked into. As I was saying, obstructive sleep apnea, it can affect many things. It can affect your blood pressure, depression, memory problems, heart rhythm problems, insulin resistance, stroke. So common symptoms are excess daytime fatigue, pauses and breaths during sleep, morning headaches, snoring, maybe moodiness, irritability. Some of the risk factors are age greater than 60, men more than women, excess weight. The thicker the neck, the more likely the muscles compress, but that you don't necessarily have to have a thick neck. When my patients come in and they have high blood pressure, maybe I'll do an echocardiogram, and it suggests that the heart has seen high blood pressure. Or if they come in with heart rhythm problems such as atrial fibrillation, which is an irregular heartbeat, I usually encourage them to go get a sleep study, regardless of if they have any of these risk factors, because it has been shown that if I control your sleep, the quality of your sleep, then I help control your high blood pressure and your heart rhythm problems and all of that. You ask yourself, how many risk factors do I have? Know your numbers. Some age, gender, family history, what you get from your parents you can't control, but these are all modifiable. This is stuff you can control. How do you control it? Get moving, reduce your blood sugar, know your blood sugar. If you're not in that range, go about reducing it. If you smoke, stop smoking. Manage your blood pressure, control your cholesterol, eat right, lose weight. And then stop making excuses. We say we don't have time to exercise. I don't have time to make myself a healthy dinner. You figure it out, because if you don't take care of yourself, no one else will to the degree that you can. Thank you, guys.